thanks for everyone being able to join us on such a lovely Thursday afternoon here in Philly. And thank you to Venture Cafe for convening this group of community leaders to talk with us today and discuss the growing importance of connectivity, particularly in this time of a pandemic. Now that we are all learning, working, and seeking important services from home as the result of the coronavirus. I'm Karmen Rajamani. I'm with Crown Castle. I'm our East Area Director of Permitting and Utilities, and I'm based here in Philadelphia. Although you may not realize it, all of our phone calls, video chats, smartphone apps, fun things like streaming music and watching videos, you're relying on Crown Castle's infrastructure. We're a technology infrastructure company. We partner with wireless carriers, businesses, governments, and communities to make sure that they all have access to technology and wireless service. Right here in Philadelphia, we're extremely proud of having over 1,000 small cell locations, 4,400 miles of fiber, 235 towers in the greater Philadelphia area, which provide that essential connectivity that we all rely on. It's great to be able to be sitting here virtually with all of my great panelists here from Firsthand Philadelphia, HC Consulting, and the PHL Connected for a deeper dive into how we all are pivoting during this challenging time and how they all are helping us address connectivity needs for their organizations and for the Philadelphians they serve. It would be really great if each of you would be able to take a few minutes to introduce yourselves and your organizations, and then we'll have a little chat and open it up to the audience for questions. So Adam, would you like to take us away and tell us a little bit about yourself?
Sure. Good evening, everyone. I'm Adam Durant. I'm the program manager with Firsthand, more specifically our high school track known as Project Inquiry. I've been with the Science Center for 4 years. Prior to that, I was a middle and high school science teacher in the school district of Philadelphia for six years. Do you want us to go into our roles, Karmen, or are we doing just quick introductions?
Oh, sure. If you'd like to talk a little bit about your role, sure.
Sure. So Firsthand is a program of the Science Center. We are a part of the Cultivate pillar, and Firsthand provides free project-based out-of-school time programming for middle and high school students, mostly concentrated in the West Philadelphia area. Firsthand basically works with companies like Crown Castle, different other mentor companies in our 3675 market space to basically develop industry relevant curriculum and expose our students to 21st century skills and job career pathways. The middle school track focuses primarily on engagement and exposure to STEM, while the high school program becomes more of a workplace simulation in order to build skills and explore different career paths. So a semester for a student may be 10 weeks. During the school day, they'll come to us for 2 to 3 hours in the middle school track. Our school partners, we really let them decide whether they like to send us a group of students for 10 or 20 weeks. 10 weeks would be a semester, 20 weeks would be the entire school year. And our high school track is 25 weeks total that goes from October to May. Yeah, so I'm gonna stop there and let the rest of the panel introduce themselves and their work as well.
Great, thank you. Rakesh, would you like to talk with us about yourself, a little introduction?
Yeah. Hi, folks. My name is Rakesh Mathew, and I have been in the healthcare space for the last 15 years, but I have worked in different verticals, telecommunication and commodities business. But my primary focus has been in the healthcare arena. I was the Chief Innovation Officer for HealthShare Exchange. That's the largest health information exchange in the state of PA. Before that, I worked very closely with multiple payers and providers in New Jersey. So I've been in the space for some time, connecting doctors and hospitals across multiple states. Currently, as a principal at HC Consulting, it's a boutique consulting organization focused on payers and providers and supporting provider and payer organizations in interoperability, making sure that clinical data follows the patients when they move from one hospital or one health system to another, and also supporting patients with the new CMS mandate for patient access to their data. So there's a new mandate from the CMS that's focused on making sure that patients can get access to their data and to a device or an application of their choice. And this mandate is supposed to be live by middle of next year. So a lot of payers, insurance companies out there are right now focusing on getting the data to their consumers or patients. That's what I'm involved in right now.
That's great. Thank you for that. And then Andrew, from PHL Connected, if you'd like to introduce yourself and tell us a little bit about your organization.
Sure, thanks, Karmen. Hi, everyone. My name is Andrew Buss. I'm a Deputy CIO at the city's Office of Innovation and Technology. Obviously working very hard on the PHL Connected program, but I often describe my role now as many do probably sort of pre and post COVID. So before March, I suppose, I had a number of things in my portfolio around innovation capacity, user experience design, content management. This is all related to the phila.gov website, as well as digital equity and smart cities. And then since the pandemic, the first couple months were largely spent within the city trying to figure out how to help 20,000+ people work remotely, which is a bit of a lift for the city, not surprisingly. And then as well, coupled very, very heavily with, I would say, a lot of digital equity work. And then since June, we've really been working very hard on the PHL Connected initiative, almost exclusively, in fact, and this is a very large project with a bunch of us working on it, but is essentially with the goal to connect what we think is about 35,000 K through 12 students that currently lack internet access in their homes. Obviously, this challenge has really come about quickly, and although the digital divide has always been there as a challenge, it has really come to the fore now. And we've been trying to get folks online so that they can school remotely now that the schools have gone to remote schooling. So PHL Connected is really, and we can talk about this more as we go on with the panel, but really a combination of wired connectivity through the Comcast Internet Essentials program, coupled with more mobile connectivity for certain households or families through Wi-Fi hotspots. Sort of a process there for getting families online. And then ultimately the goal is to fold this PHL Connected initiative focusing on specifically K through 12 into our broader digital equity work and strategy that we are developing in the city and have to some extent already.
Wow, that's great. And so, Andrew, it's like you're reading my mind. I think that addressing what you were doing pre-COVID and then post-COVID and the connectivity and with education, which has been so important now that, for example, my elementary school children are all trying to learn at home. And boy, I am a mediocre homeschool teacher, if there was one. But the connectivity has really become such an issue and something at the forefront. So that I was thinking as you were reading my mind, you know, that the difference of your work pre and post COVID, which I think that you addressed, and unless there was some other issue you'd like to, or detail you'd like to put a period on, but how you have adjusted your services, and then what role does digital access and connectivity have in that? So it's really interesting, and there seems like there's so much to unpack in what your team is doing now in trying to connect families, that there's a process getting them access, that I'm sure there is a price point that, you know, making sure that it is available for folks. Do you want to talk to us a little more about how you have adjusted your services for what you're providing now? It sounds like you've really pivoted in this important time.
Yeah, I think a lot of our work previously was, you know, for K through 12 households, but it went broader than that. And really, you know, we started thinking about K through 12 specifically probably in June, I would say, just because of the time crunch we were under with trying to get kids online for the start of the school year. And I should note too, when I mentioned the wired connectivity on the hotspots, this was a bulk buy on the part of the city. So the access is actually free for these families who do not currently have it. That was always the goal of this. Obviously, Comcast has this $10 Internet Essentials program. Pretty good price point, actually. So I think to some extent, but we know at the same time, there are a lot of families for a number of reasons that do not have access despite that pretty good price point. So we felt it was important, and we're able to raise quite a nice amount of funding kind of through a variety of funders. I sort of refer to it as like a flavorful funding cocktail, really, in order to do this bulk buy. And then we're just starting the program, really. I mean, school started, as you know, I suppose last week. And really in this outreach period now where we have to try to reach some of the families that are harder to reach. So probably coming to a critical time now where teachers are looking through their rosters and seeing who has and who has not been participating, and then doing those individual connections. And I think that's what will probably drive our numbers up quite a bit ultimately.
Right. Wow. So interesting. And I mean, so timely. You're really on the forefront of these really important issues that are in the news, I think, at least every day. And so, Adam, would you like to talk a little bit about how your work with your organization has had to pivot pre-COVID and then post-COVID?
Absolutely. So COVID kind of happened in the middle of our showcase season. So usually every spring from about mid-March to early May, we have showcases for all of our classes, and they present a project to the Science Center community at large and other people in terms of teachers, parents, whoever they're open to the public. So pre-COVID, we were basically gearing up to have all those as normal, and COVID kind of came in and forced us to cancel all those plans. And then we kind of had to figure out how we were going to adapt and try to make it easier for our students to connect with us, but also understanding that they are going through a very scary time. And the work Andrew does, obviously all of them didn't have access to internet, didn't have access to reliable computers. So we had to figure out how we can become virtual, because we are a place-based program, and at the same time differentiate ourselves and not be another login time for our students, because we know that they were going full virtual. So over the summer, the middle school team, shout out to them, sent 60 kits, and basically they were like STEM at home kits. So they were paired with virtual sessions. Each 4 labs were packed, sent to the students, or they picked them up in person. And then they followed the demonstrations along with the lab, so they can do hands-on science at home. So the middle school team launched the summer. They sent out 60 kits. That was a success, so much that this fall we plan on sending about 110 kits to students, and in addition to our virtual programming. We also started a program called Firsthand Ventures, which is designed to be a continuous kind of mentoring program where students can come to us with ideas for products or services, and we basically flesh out a business plan, connect them with mentors, and even fund some of the materials they may need to start those ventures. So that has been a shift in ours as well. And we also, with the high school program, plan to launch an in-person hybrid internship model. We have a company that we're partnering with, Cohere, that has elected to take about 3 to 5 of our high school students. And we think, I think particularly is a great opportunity for high school juniors and seniors, those students who don't need to be in school the full day because they have enough credits to be able to get some workplace experience. So my role is going to be facilitating that with companies, and also hopefully growing that into a permanent thing moving on to the future.
Wow, that's great. I mean, the innovation, and how I'm really impressed with so much of your pivoting on in such a difficult time.
Thank you.
And then with Rakesh, how about you? How have you changed from your pre-COVID to your current post-COVID situation?
Yeah, so I've been lucky to be in the middle of both the insurance companies as well as hospitals, payers, and providers for a long time. So it's interesting how both organizations have pivoted. I want to take a couple of examples. The organizations that I worked very closely with, one being Independence Blue Cross, the other one Christiana Care in Delaware. Both organizations acted pretty quickly. They actually sent all the non-essential folks, all the IT folks who do not need to be physically present in the building home, and they made that decision pretty quickly in March itself. And what I saw is very interesting how the providers, from a hospital perspective, Delaware, Christiana Care being the largest hospital system in Delaware, they quickly pivoted to something that they had been planning for a long time. Virtual care is something that many organizations have dabbled in, and organizations have spent a lot of time and energy trying to figure out what's their telemedicine plan, how are they going to do virtual care over the next 5, 6, 7 years. And it was interesting how some of those plans that had a 6-year launch time got compressed into 3 months, and there were solutions out there already. People were doing teleconferencing, leveraging Microsoft Teams, leveraging Zoom to do some of these non-contact interactions with the patients. As you may all know, there was a big shutdown on elective surgeries, elective procedures, routine visits for patients. And that doesn't mean that people are not getting sick. That doesn't mean that people who need, elective procedures do not need them. It just got postponed. Of course, we don't know what the effects of that are right now. But what I've seen with the big health systems in this region is that they have quickly pivoted to the remote care or the virtual care model. And a lot of emphasis is now put on the remote patient monitoring side of things. This is something that has been predominantly something that the payers or the insurance companies have been focused on. And now you can actually see that hospitals are actually sending kits to patients and allowing them to use some of the pulse ox or the blood pressure monitor at home while they're having a telemedicine interaction with the provider. So I think some of these things are here to stay. Telemedicine rules have been changed in ways that many folks did not even expect that it would happen so fast. So I would say some of these things happened as a blessing, but of course the effects of COVID on the healthcare system is huge. Many hospitals are still losing money, and that may end up, resulting in some of the hospitals shutting down or even having to merge or sell off. So you're going to see some more changes in the Philadelphia landscape based on what COVID has done.
Mm-hmm. Right. Oh, no, go ahead.
Oh, no, I was done.
Yeah, well, know that on the virtual healthcare, actually, that early on in the pandemic, like 2 weeks in, it was like the end of March, we had to do telemedicine. That I have 4 small children, and my youngest, she managed to slam her finger in a door and it looked terrible. And I thought, oh my gosh, we can't go to the doctor. I mean, we were scared to go to an emergency room. So we called our insurance company and we did a televisit. And it was really so helpful. She was able to give us a diagnosis. We didn't have to go anywhere. And it turns out that she's fine. Her finger is fine. But we thought it was broken. And she's, so small, she couldn't really tell us anything. So we weren't sure what was going on. That kind of thing for us, gosh, as a consumer, I hope that's the kind of thing that stays. What do you think of the different examples that you provided? Do you have some sort of idea of these are the sorts of things that you think may stay as a post-pandemic improvement?
Yeah. So something that's unique to the healthcare business in the United States is that no matter how much innovation you bring into healthcare, the cost of healthcare just keep going higher and higher every year. It just doesn't come down. And that's something that the government has been trying to do. That's what the insurance companies are trying to do. States are trying to do, bring down the cost. I think from a telemedicine virtual care perspective, there's a huge cost savings, whether it is now when somebody loses money, there's always the ups and downs of that, right? It's not like everything is going to be even, but at least from an overall perspective, it's number of trips to the hospital, number of trips to the ER, the fact that the doctor can actually probably see more patients without needing to travel to different locations and things like that. It definitely is a huge advantage and a big advantage in reducing the cost of healthcare. So we think that it is going to stay for the long term. We can already see that CMS with Medicare and Medicaid have started reimbursing telemedicine at higher rates, and that means the private insurances are also going to follow that. So again, I think this is something that is here to stay. Another key feature that it has been there for a long time, rural hospitals, rural areas around the country do not have the level of medical support that you would like to have. And telemedicine has been the filler, or that fills that gap. And now with better reimbursement, and also doctors need not worry about states. So there could be a doctor who is sitting in New Jersey treating somebody in remote Colorado, and that is a huge benefit. So I think some of those things need to stay.
Yeah, that's really interesting. So there, with all of the discussion of innovation, which I as a technology person I really gravitate to, there is an important difference between access and adoption. And so for each of you, how are you helping to address digital literacy to increase this technology adoption? I know that, even, well, with my husband, not even to talk about my father. My father's, wait a minute, I mean, he just graduated from a flip phone. So, it was like fabulous. But even, with this online learning that we're doing with my children, that my husband's like, I can't get the Zoom to work and all of this. People are more comfortable in using all of these innovations if they do have some knowledge behind that. And so, Adam, I don't know if you might like to tell us a little bit about how, I don't know, with middle and high school students, maybe you don't need to try to encourage them very much for digital literacy, but if you have any insight into that.
Yeah, I think what we like to integrate in our programming is some type of new tech app or feature. They're usually integrated in our project. So the students, when they come to us, are using our digital studio, our laptops. We use different, depending on the project, we may use Google AdWords, and they might be introducing them to that technology for the semester. A digital illustrator called Canva we use a lot. Marvel, which makes basically mock-ups of apps. We actually use those for the Crown Castle project this past spring. We use Makey's a lot. So I think what we assume is that the students access, kind of what you said, is dependent on the telephone. and we just try to expose them to non-social media apps and different tools they can use to enhance their creation or just make things easier for themselves. So I would say in our lab, we definitely use that and make sure that we introduce those things. And then in terms of communicating with them now, we introduced a new SMS text message system to keep in contact with them. It's called Text Magic. That has been really helpful. We've discovered that email is not the best way to talk to middle and high school students. So we were like, what's the fastest way to reach them? And we were like, we need to start texting them. But it's been great because we've been able to reach them, their parents, and send out mass messages in terms of staying in touch with them. We rely heavily on our school partners to communicate with our students during the normal year. So that shift has been very important for us, and one that we feel like is definitely going to be here to stay. Has been very helpful in just communicating and keeping all of our students in communication, because we won't see them on a weekly basis as we usually do.
Right. And so you're doing more of the direct communication with your students as opposed to going through schools.
Absolutely. Yeah, we have to. Actually, we found out over the summer that a lot of the school districts' emails for the students are blocked to outside emails. So that was another challenge that we dealt with this summer. So yeah, we are making sure that we get reliable contact data. So because we never know, what may happen.
Right, it is. It's those details. For what I do, you think you have an innovative idea, but you have to really think through the operational details, because if I have old email addresses or that the same thing happened with our school district, that everybody's kind of the database that we were using to communicate with teachers, it cut off the day that school ended. Well, of course it did if you thought about it, but you're like, wait a minute, I still need to talk to you about, what kind of summer enrichment we should be doing or that sort of thing. So yeah, to think through those details is so important. And then Andrew, how about you with your, your resident customers? How are you helping to help with your folks' digital literacy?
Yeah, earlier you had asked about what sticks after the pandemic. And I think one thing we'll find certainly is that access rates will certainly go up, right? And I think that's been just forced on people in a way. You must have an internet connection now. Kind of the whole point of the PHL Connected program. And then I think, we often talk about three pieces to the challenge. There's the connectivity side of things, there's the device side of things, and then there's the digital literacy side of things. So, with our program, devices were being handled, fortunately, by the school district. So there was this incredible Chromebook distribution in the spring and into the fall. And then digital literacy, I think, will always kind of lag behind. And I was thinking, as Rakesh was talking about telemedicine, that's a big challenge, I think, to participate in that for a lot of people who are not that facile with technology, right? So I think one way the city was handling that before was through its public computing centers. There's a program called KeySpot, if you're not familiar with that, or at the libraries as well, where you would have someone there who could help a person sort of navigate the machines, right? And the connectivity and doing internet searches and things like that. A lot of those places, of course, are now closed or are having to do it in a more remote, socially distanced fashion. So I think one of the things we'll have to figure out as a city is how we sort of take over that function of what used to be in person, where people would go to a center, participate with others in doing that work, to something that is done perhaps by yourself. And that's a bit of a challenge.
Yeah, that would be, gosh. So that's, it is that in getting people, I think it's so interesting about the three pieces, that those are really the basics of what you need to make this work. It would be if you had a couple of them, but if you're not comfortable with it, then it doesn't work. And you're right about that. We love our local library. We have the same sort of thing. Somebody is there to kind of help you with all of those services. And that's not available now, I think, is a real challenge. And then for you, Rakesh, any other thoughts that you have about access and adoption? How you might be helping encourage digital literacy. Digital literacy, excuse me, to increase technology adoption, in the healthcare space.
Yeah, so it is so interesting is that there were some statistics that came out from the initial virtual care approach that many of the hospitals that rolled it out, and an interesting part is that the the number of folks in the age group 20 to 35, in some ranges even close to 40, who did not usually use healthcare as often as before have started using healthcare because of the ease of access, and the fact that it is right on their fingertips. They can actually, get an appointment and actually talk to the doctor right on the phone. So the number of people using healthcare in that demographic has actually increased. But at the same time, people over 50 have reduced the use of healthcare, especially the ones who predominantly have routine visits, would go to the doctor's offices on a regular basis, have actually reduced the visits, and they have not migrated onto the virtual platforms. I mean, at least in the last 6 months, we haven't seen that. But there is a big push from the insurance companies at this point. It's interesting is that most of the insurance companies out there are making record profits. They can't make profits because most of them are non-for-profit organizations. But the main reason is that they're not paying out as they used to before, because the people are using less healthcare. So what they are doing proactively is to actually send out mailers and have education campaigns to patients and members of their insurance plan, how to use telehealth, how to use a virtual care products that they are launching. And it's I don't know how effective they are. We probably have to wait for another 6 to 8 months to see the results of this new communication drive that's going out. But the insurance companies are definitely trying to do that. This is basic economics from their perspective. If they are not going to be spending all the money that they collected as premium, there is something called medical loss ratio. They have to use 80% of the dollars that they collect as premium for healthcare, and only 20% can be used for administrative purposes. And if that ratio is not in that 80-20 range, they have to pay back premiums next year. And insurance companies don't want to do that. So they're definitely trying to get people to start using healthcare more. So it's again, I think all parties are trying to encourage this, but as Adam mentioned, we'll have to see how the older folks and people who are not that tech savvy start using this.
Right. Wow. Let's see, I do see that we have a number of folks who are listening with us and participating with us today. And if we have any brave souls out there, for any entrepreneurs, gosh, I have not had enough coffee. If there, for any of our innovators with us today who are listening, if anyone feels brave in sharing a key challenge where you think that there might be a potential for an entrepreneurial solution, that we've heard a lot of innovative ideas today, and how our panelists have been pivoting in a very quickly, looking for solutions and implementing those. So I'm not sure if anyone in the audience has a challenge where they have a great innovation they'd like to share. Okay, we'll say that you're thinking about it, and that's good. And so I'm wondering that if, for Adam, Andrew, or Rakesh, if there was anything else that you thought, as you've been, working through this in real time, as you've been going through, gosh, it sounds like you've all worked on so many innovative things and have implemented them. Do you have something that right now is top of mind that, okay, this is the priority on my checklist for, your organizations? And Adam, I'll start with you if you have a thought about that.
Sure. I think priority is just for us right now is just to just find out where we can fit in. I think we don't have I think the priority is just engagement, rather that is just staying in communication with our school partners. Like I said, we do plan on do virtual programming. So I think the biggest challenge for us is just to make sure that everybody is able to, like I said, we were able to reach everybody. We can engage them in some sort of way, and we can identify where we're needed, because our mission and our goals kind of shift in terms of supporting a school. We might be able to support more students. So I think that's exciting as well, is that being virtual allows us to expand our reach. But I think right now our primary focus is to make sure that our school partners and our students are still engaged and still feel like they're connected to firsthand, because it'd be very easy to kind of lose track of them and lose focus and without being able to see them.
Right. It is the connectivity and have that continue when we're not next to each other.
Yeah, and I just wanted to add one thing is we're, in order to increase that, we're doing virtual tours, and we're experimenting with virtual mentoring, which would be new for us as well. So now we have the possibility of introducing mentors from across the country instead of just being local. So that's exciting as well.
Well, that's true. It does give you a broader range, which would be an upside from all of this. Thank you for that. And Andrew, how about you? Of all the things that you have working, is there something that, well, gosh, here's a challenge that is a priority for me and my team to be trying to resolve?
Yeah, I think within the digital equity space, it still remains kind of broadly innovation. Like, I'm a big fan of trying new things in this space, because I think to some extent the digital equity world has become a bubble of thought, a bubble of its own thought. And I think that's one reason probably that a lot of these numbers have not moved that much over the last decade, right? We still have this digital divide problem. It's pretty clear. And I think what we need to do is continue to try interesting things. Hopefully some of those we'll learn through PHL Connected, that can eventually drive the access numbers, or improve the access numbers, I should say, and enable people to be more digitally literate and do the things they want to do. I mentioned the Digital Literacy Alliance perhaps earlier. That's really the point of that organization, is to be a grant maker in the space to generate innovation around digital literacy. So we do these small grants, and I think we have identified a number of best practices through those grants. And just to close, I would say the innovation is important, because in this space, that's what's been lacking for quite a while. Not that the people aren't innovative, but rather that there's never been sort of the thought and the discussion, and especially the money around trying new things. You're always trying to just tread water and get people connected to some basic level of connectivity. So sort of the ability to strategically move it forward has lagged.
Right. And now there's every, push in the world to really up those numbers, right? Because that's how we are getting these vital services. So, right.
Yeah. And I think it's a test really for this program, I think, to see whether subsidizing internet is of a sufficient factor that that you will see a big uptick in numbers, right? Because a $10 a month option is pretty good. Mm-hmm. I think there are still a lot of families who that is a burden for.
Right.
And this is a test in a way to see, okay, if it's free, does that spur these families to get an internet connection that they wouldn't have had before? It may be, it may not be.
Right. That is it. But it does go to your three pieces of that connectivity puzzle, right? That they would have access devices, maybe within, as you mentioned, through their school district, they'll have that. It is to break it down into those pieces, I think is helpful, but it is really what a challenge. So, gosh. And so, Rakesh, how about you? Is there some big innovation, some big challenge, a priority for you that you're trying to work on?
Yeah. Just to add to what Andrew was saying, on that topic, is that I wish, you can always wish that internet access becomes a fundamental right. that every person in the United States get access to it. That would be great. On the healthcare space, this is a little aspirational from what I'm thinking is, I was on the COVID-19 task force for surge planning, and it took about 3 months to plan what would happen if we were hit just like New York. The greater Philadelphia region was hit, Delaware, New Jersey, and parts of Pennsylvania. How would we manage that? But luckily, we did not get hit. But the plan that I worked on and ended up used in Texas and Arizona, because they were having patients move from one state to another as part of their search. So it was effective. But one key thing that came out of that was, we were planning to move patients from one hospital to another. Patients who did not have COVID, trying to move them to other hospitals, health systems, just to isolate them from the COVID patients. And while we were planning all these things, we were finding it so difficult to properly match the patients, properly make sure that this patient's record matched to this patient. And even when we were doing testing, a lot of people who did drive-by testing did not give full information. And we found out that about 40% of the drive-by testing that were done, we couldn't associate the test with the patient. We had a phone number that was valid, and we could call them and say it was positive or negative, but we couldn't actually add the test to the patient's chart because we couldn't actually find the patient. So patient matching is a huge issue and something that needs to get addressed. And as we go through the next phase of this with mass immunization, and we track the vaccination records at a state level, it is going to be a huge task to collect all that information and bring it to a central place. And I know there are organizations out there that can help and do this, but there's no one solution at this point. And I'm hoping if there are innovators on this call who are thinking about this, definitely there's opportunity out there that they can go after.
Right. And I mean that you as a patient would have access to that, right?
Yeah, and that is a big issue, right?
Mm-hmm.
And I also hope that this new CMS mandate that is out there, where every patient has the right to get their clinical and claims information to a application of their choice on their phone. And by end of next year, I would have that ability. So if I end up in a hospital, I would have all my records on my phone and I can share that. And right. CMS is going one step forward. In 2022, they are basically saying that if I switch my insurance companies, say, for example, I switch from Aetna to United or United to Cigna, I should have the ability to tell my previous insurance company to send all my records starting from 1/1/2016 over to the new insurance plan. That's huge. That will bring all the insurance companies to connect among themselves to make sure that patient information flows wherever the patient gets insurance. So wow. I'm hoping that these things actually happen.
Right. Well, you'd think that with the technology, right, that, gosh, why don't we have that? But again, as you dig into the details, there's a lot there. Let's see, the time has flown by. I see that we're getting to the end of our time together. And I do see that I think, Gary, we have at least one question. So if we want to I have our audience member ask.
Sounds great. So it looks like we have a question from Ashley, as well as Joe has his hand up. Joe, if you'd like to go ahead and ask your question, go for it.
Not a question as much as I want to say hi to all of my Venture Cafe friends, for one, and particularly cite in the firsthand Project Inquiry friends too. We're proud to support that. I'm with AT&T, Joe Divis with AT&T. I want to just congratulate Andrew. He gave some short shrift to the Digital Literacy Alliance, and I think actually that might be a really good topic for a future discussion, because a lot of what the Alliance is doing, and it's made up of providers, advocates, folks from the academic sector, and other interest groups, and done some pretty, I think, entrepreneurial things with the Digital Navigator grants and things like that, and kind of looking at how in a deliberate way move the ball forward, not obviously with huge broad strokes, but really strategically. So we've been a part of that since its inception, and it really is really good at kind of getting into moving the needle on people's capacity to use, the capabilities when they're there. Obviously, getting the affordability and the access is part of that too. But so it just, they're doing great work, and the Digital Literacy Alliance is something that I think could be fleshed out a little more to this group. And just to let you know, during COVID, it's been a pretty big ride for us at AT&T. 25% increase in our network traffic the first week of work from home. Seen huge, upgrades in Wi-Fi calling, messaging. There's been a resurgence of voice, which is interesting. Voice was seen as kind of just, obsolete or old-fashioned, and so I think we're going to have to continue to keep up our game as society learns how to adapt during COVID and even in post-COVID world, as we conduct our affairs in new and exciting and innovative ways. So, but I wanted to give a shout out to Andrew and the great work the city's been doing in this space.
Great, thanks for that, Joe. And always nice to have an additional shout out to one of our panelists. Gary, do we have any other questions? No?
I would love to go to Ashley, if Ashley would be willing to.
Sure. Adam actually answered my question, but I have another one for Rakesh. Rakesh, I think one of the concerns that has really come to the forefront as there has been an increased usage of telehealth services is ensuring that patients are able to maintain their privacy. Do you have any recommendations for insurers and providers and for policymakers with respect to ensuring patient privacy as we increasingly use virtual health services?
Yeah, so telehealth, and especially virtual health, has certain nuances in there, but telehealth is still covered under HIPAA. So all the HIPAA privacy rules that are out there, the providers and the payers have to abide by them. So it's not something that they can skirt around. But the gray area around virtual care is when you have remote patient monitoring stuff, or devices, not stuff. So for example, if you have a weighing machine in your house, or if you have some kind of monitoring device in your house, it's not clear, it is not completely covered under HIPAA. It actually falls under FTC. It goes under a different part. So the protections that a patient might have under HIPAA may not fall for all the devices that the patient may be using. So if you, for example, if you are using a Fitbit and if data is getting transmitted from your Fitbit to your doctor, till the data reaches your doctor, it is not covered under HIPAA. Once it gets to the doctor has or the health system has is legally obligated to protect that data. But it's that nuance where it's your device, it's something that's not covered under HIPAA, you are transmitting the data. There is some gray area there. And FTC is coming out with new guidance, and they are trying to align it with the new CMS interoperability rules, so that when patients do get access to their data onto their devices, they want to make sure that that data is protected, and that there is some liability if there's a breach of that data. So the government is moving towards that, but it's not there yet.
That was a great question. Thank you, Ashley. Gary, any other questions? I'm seeing some new faces on our Zoom Brady Bunch view here. Any brave souls? No?
Yeah, if anyone has a question, feel free to raise your hand and we can call on you, or enter it into the chat if you'd like to ask that way. We've got a few more moments here left before we transition into our next session, but definitely want to make sure that anyone with a question has the opportunity to ask it.
Okay. Well, if we don't have any other questions, maybe I will ask our panelists a final question, just to kind of send us off here. And so more on the brief side, but for each of you, what do you think is the greatest opportunity for your organization that was born out of the necessity to go, all of your functions virtually? That's such a big question, but if you want to think about that and kind of be a little to the point. So Adam, I'll start with you.
I would say we're really excited. Personally, I'm excited to get this internship virtual hybrid model off the ground. I think it has the opportunity to be integrated in schools, especially for 11 and 12 graders who don't necessarily need to be in school all day. And I think that us as firsthand, we're excited in order to have virtual mentoring, virtual sessions to see how many people we can actually connect with, because we have been limited to our physical space. But now that that physical space isn't being used in that way, we're excited to see kind of where our footprint can go out to. I think that's the most exciting thing, at least speaking for myself.
Yeah, no, that is a definite positive of the situation we find ourselves in. Andrew, how about you?
I think within our organization, I'm moving away from the digital equity topic a bit here, but I think within our organization, it's kind of amazing now how many municipal employees are working remotely, right? Because that was not a thing before. It was very hard to get organized, like I said, the first couple weeks of this, first couple months really. But I think that a lot of us have now proven the case, and some of us wanted to try this before. We've proven the case that we actually can work remotely. City employees are responsible enough to do so, and they remain productive enough to continue to do so. So, you can then start to look at some potential cost savings down the road as well in terms of buildings, facilities, things like that. Whether we ever get to that as a city, I don't know, but at least we've proven the case that we can do this productively and responsibly.
Right, and so many businesses are finding themselves in that same place, right? And depending on depending on the predictions, how that may play out, real estate, office buildings, depending on, again, how this goes, this may be transformative. So yeah, I think lots of businesses have the same thing. We've all been asking for a little more flexibility in working from home. And so this has proven the case. I mean, I think across the board. So yeah, so that's really a good point. And so Rakesh, how about you? Any last comment about the greatest opportunity here to come out of this situation?
Yeah, I mean, as I said, I'm working with a boutique consulting company, and we've been remote for some time. But this suddenly gave us an opportunity to even expand pretty rapidly. The biggest advantage is we can get talent anywhere in the country now, and even some of the talent outside the country. The expectation of my clients have changed. Before, most of the interactions were in person, and we had to be at the client location. So now that has changed. Everything is virtual. So I can have a global team that's working on a local client with a local client. We have not explored the potential of international clients, but this also opens up that opportunity to look at clients outside the US. So from a business perspective, I think this has definitely changed the game. I definitely do not miss the travel that I used to have in my previous life. You know, the conferences and all the other things that you had to fly all over the country are now all virtual, and they are working fine. One of the biggest things that and many of you might have actually seen this, is virtual booths. So when you go to a conference, one of the big attractions there is you go to the different vendors, try to understand what they do and things like that. Now these conferences, the virtual conferences that you have virtual booths. You actually go to the booth, you talk to somebody. It's almost the same thing. It's just that you don't have any human interaction. But what I'm seeing is, you know, because of the success of these virtual conferences and the fact that people are attending more of these, I think when we are outside of this COVID-19 timeframe, these things may not change. We may actually have more virtual and less in person. So there are pluses and minuses of that, but I think overall, it makes people more efficient.
Yes. I don't know if I miss the travel. I traveled a lot before. I could get out of my house a little now, but I hear you. Well, just thank you so much. And just in conclusion, Gary, I know I'm looking at the time. I don't want to overstay my welcome. So thank you so much. That this is, I mean, again, the innovation and just the quick thinking in these very, you know, variety of industries, from healthcare, education, government services, innovation, is really exciting. And just the entrepreneurial spirit is really uplifting. So, you know, gosh, kudos to all of the panelists. Keep going. So exciting. I'm actually really proud that, you know, Crown Castle has a little bit, you know, in helping showcase this, but also whatever, you know, that we are helping to support some of the initiatives here. But just really the innovation and the quick thinking is really impressive. So, gosh, I hope that everyone enjoyed the time together, and thanks for the opportunity.
Thank you, Karmen.
Thank you.
Thank you, Karmen.
Thank you, everyone.
Thank you.
Crown
Thanks for
Castle,
coming.
Karmen. Thank you to all of our panelists. Thank you, Ashley and Samantha.